Can babies be allergic to breast milk? Again, while not super common, it is totally possible. Allergies to proteins in breast milk will look different than food allergies you may see in older children. The most common symptoms are mucus or bloody stools, stomach pain, eczema or rashes, or colic. How do you know if baby is allergic to breast milk? In this case, the infant may show signs of severe colic, abdominal discomfort, or a skin rash such as eczema or hives, or may react with vomiting, severe diarrhea, often with blood in the stool, or difficulty breathing that lasts up to several hours after breastfeeding. Can some babies be allergic to breast milk? No. The natural proteins in breast milk are so mild that they just do not provoke allergies in babies. That's why the American Academy of Pediatrics, AAP, says that breast milk typically doesn't cause allergic reactions in nursing infants. What is the most common allergy in a breastfed baby? Milk intolerance. Cow's milk protein is one of the most common causes of food sensitivity in a baby who is breastfeeding. Cow's milk protein intolerance is a reaction by the body's immune system to a protein found in cow's milk. A milk allergy or milk protein intolerance is different from lactose intolerance. Can breast milk upset baby's tummy? Having too much breast milk or an overactive letdown can also trigger gassiness. Oversupply can cause the baby to overfeed or swallow too much air, causing an upset belly. Make sure you're emptying one breast fully before switching sides so baby gets all of the stomach-soothing hindmilk. What foods to avoid while breastfeeding? 5 foods to limit or avoid while breastfeeding. Fish high in mercury. Some herbal supplements. Alcohol. Caffeine. Highly processed foods. What foods are breastfed babies sensitive to? Common allergens include dairy, eggs, fish, shellfish, peanuts, tree nuts, wheat, and soy. 1. If you suspect your baby is allergic to something you are eating, try cutting these out of your diet, one at a time, and see if your baby's health improves. It may take up to 10 days for it to clear from his/her system. Should I stop breastfeeding if my baby has a milk allergy? You can still breastfeed or chest feed your baby even if you suspect that they have a cow's milk allergy. But to avoid passing on the proteins that trigger the allergy through your breast milk, you must eliminate cow's milk and dairy foods like ice cream, cheese, and yogurt from your diet. When does a milk allergy show up in infants? Babies with a milk allergy often show their first symptoms days to weeks after they first get cow milk-based formula. Breastfed infants have a lower risk of having a milk allergy than formula-fed babies. People of any age can have a milk allergy, but it's more common in young children. Why are so many babies allergic to breast milk? Babies are not allergic to breast milk, Dr. Jellick reiterates. Very little food protein is passed through breast milk directly to the baby, so the chances that your baby will have an allergic reaction to something you eat is very, very small. So, go ahead and eat those peanuts. Can you test breast milk for allergies? Free to Feed is a medical technology company dedicated to finding solutions for mothers of food-intolerant infants. We have designed an allergen test that identifies various food proteins in breast milk, allowing breastfeeding mothers the opportunity to determine what is eliciting a response in the infant. Can cold breast milk upset baby's stomach? Is it safe to feed babies cold milk? Yes, it's safe to feed your baby cold milk. In fact, frozen breast milk can be used as a form of pain relief for teething babies. Why is my breastfed baby so fussy? There are lots of reasons why a breastfed baby might sometimes seem unhappy or fussy, such as being hungry, having allergies, sensory processing issues or lactose overload, and more. When should you not feed breast milk? How long should a mother breastfeed? Recommend that infants be exclusively breastfed for about the first 6 months, and then continuing breastfeeding while introducing appropriate complementary foods until your child is 12 months old or older. Why can't some babies drink breast milk? Reasons that your older baby might refuse to feed at the breast could include, something has changed that makes it difficult for baby to latch. A strong or fast flow of milk, which your baby is struggling to take. A painful mouth, due to an infection like thrush or because they're teething. Why shouldn't you put warm breast milk on cold? Mixing freshly expressed breast milk with already cooled or frozen milk is not advised because it can rewarm the older stored milk. It is best to cool freshly expressed milk before combining it with older, previously cooled or frozen milk. Why can't babies drink water? It's because babies' bodies aren't suited for water until several months after birth. Tiny tummies and developing kidneys put them at risk for both nutrient loss and water intoxication. Why isn't my baby satisfied after breastfeeding? Your baby is going through a growth spurt. Babies go through so many changes in the first few months than at any other time of their lives. They've also got tiny stomachs and immature digestive systems exactly at this age. Combine the two, and no wonder your baby never seems satisfied after breastfeeding. Can babies reject their mother's milk? Many factors can trigger a breastfeeding strike: a baby's sudden refusal to breastfeed for a period of time after breastfeeding well for months. Typically, the baby is trying to tell you that something isn't quite right. But a breastfeeding strike doesn't necessarily mean that your baby is ready to wean. How long is breast milk good for? Freshly expressed breast milk can be stored in the back of the refrigerator for up to 4 days in clean conditions. However, it's optimal to use or freeze the milk within 3 days. Deep freezer. Freshly expressed breast milk can be stored in the back of a deep freezer for up to 12 months.